Practical, basic knowledge for evaluating low back pain. This is the second time. This time, I'll talk about interview. When you hear the title, interview, you may feel that. You want to know something more practical than interview. I guess there must be some people feeling like that. But if you feel that way, you should learn more. Because interview is very important for clinical practice. And surprisingly, excellent clinicians usually spend time on interview, because there's a lot of information that can be found by interview. So the important thing is to listen to the patient and focus on the keywords from it, so you'll understand why the patient's pain is happening. Don't you think it's important to predict what's necessary for the patient? By conducting interview, most importantly, it's possible to predict the condition properly. In that sense, I'd like to talk about the basic knowledge of interview here. Interview that I'll talk about in this course may be a little different from what is written in the so-called textbook. When you read things about interview written in the textbook, there are a lot of details, so you may feel overwhelmed by how much time it'll take. If you do it this way, a 20-minute treatment at a time will end with only an interview. There are a lot of contents like that, right? But, in my opinion, I don't think everything written in such textbooks is useless. But the first thing you have to know is the interview method that is really useful in the clinical field. Please know this first. On top of that, I think it's important to learn more about interview and to gain a deeper understanding of it. I don't think you can move forward unless you understand the interview method that is useful in clinical practice. So first of all, I'd like to explain the really useful interview method. Interview that attaches importance to being useful in the medical practice. I'm going to talk about it. I think my story contains a lot of ideas of Mr. Norio Hayashi and Mr. Takaya Narita. In such a situation, I'll interpret it in my way, and I'd like to provide an easy-to-understand explanation of the interview method that'll be useful in your clinical practice. First of all, when did the pain start? This is quite important. Rather than immediately asking the patient where the pain is, it's important to ask when the pain started. Because, as you can see here, the treatment we provide is completely different, depending on whether the pain is acute, convalescent, or chronic. For example, if a patient has been in pain for 2 days and has been unable to move, I don't think it's appropriate for us to provide them with exercise therapy. After all, rest is necessary during the acute phase. If you have inflammation, I don't think you can improve it with exercise. So first of all, it's important to know whether the patient's pain is in the inflammatory phase or whether the inflammation has ended. And the chronic stage. In a true sense, it's during the chronic stage that therapists can truly demonstrate their abilities. I think it's very important. That's because, even if it's the same low back pain, if it has been going on for 2 years, the situation is a little different. So I don't think it'll get better unless you get proper treatment. For example, in the acute or convalescent phase, when someone says they got better after some kind of treatment, it can be a little hard to know if they really got better or if it was just natural healing. I wouldn't say that all of this is the result of natural healing, but it's a little hard to tell. However, in the case of chronic phase, if a patient has had low back pain for 2 years, undergoes some kind of treatment, and comes back the next week feeling much better, this can't be considered the result of natural healing. You can tell that something you did was good. That's the important thing. In that sense, it's also necessary to know how long it has been since the onset of low back pain. And when it comes to low back pain, it's important to know where the pain is. For example, the area covered by a t-shirt and shorts is innervated by the ventromedial nervous system, and this area is unexpectedly weak in spatial cognition. So even if a patient complains of low back pain, upon closer evaluation, it may actually be buttock pain. Patients may also complain of pain in the low back, despite the pain being in the side. And since the general public already knows that herniated discs and spinal stenosis cause pain in the lower limbs, patients may complain of low back pain even though they have pain in their legs. So it's very important to first find out where it hurts. This also applies to shoulder pain. For example, even if your shoulders are stiff, the shoulders themselves don't hurt. In such cases, patients usually point at the trapezius area. If the shoulder itself hurts, of course they'll say they have shoulder pain. Also, even if they have neck pain, they may say they have shoulder pain. Therefore, when you listen carefully, you may find that the facts are different, so you need to evaluate it properly. And in the case of low back pain, as shown here, there are cases where only the low back hurts, only the lower limb hurts, and cases where both hurt. In the case of lower limb pain, the important thing here is, even if you suspect that the pain in a patient's legs is coming from the low back, there are cases where people really do have diseases in their lower limbs, right? So you need to evaluate that as well, and sometimes both hurt. When a patient has low back pain, leg pain, and also a herniated disc, in this case, most medical professionals would assume that they're all related. But what really matters is, you need to evaluate whether they're truly related. So there may be different reasons for these. Do those pains have the same cause? For example, if a patient with low back pain has a herniated disc and also has pain in the leg, is the low back pain related to these? There may be cases like that, but there may also be cases where it's different. So it's important to check it carefully. Are they from the same reason, or are they from different reasons? And there are two types of pain: pain at rest and pain during movement. These two are very different. For example, if you feel pain when you stay still, there may be some diseases that are out of control. If it hurts when you move, it's important to know if there are certain movements or positions that cause pain. For example, if you experience pain when sitting for a long time, even if you're still, this is classified as pain caused by movement. In other words, it's pain caused by a certain position. So, as in this example, if pain occurs when moving, it's important to ask whether there are certain movements or positions that cause pain. If the pain persists even when you're still, sitting, asleep, awake, or doing anything, it may be impossible for therapists to treat it. So it's important to evaluate what's causing the pain, including those kinds of situations. In many cases, the pain occurs when you move. So, if it hurts when you move, you need to find out what movement is causing the pain, and you need to do various tests to find out. For example, as shown here. I think that the patterns listed here are the most common. It may hurt when you sit, when you stand for a long time, or when you walk for a long time. This pain when walking for a long time may be in the same category as the pain when running. Also, there are cases where it hurts when bending backwards, or when bending forwards, or it hurts so much that you can't bend at all. And sometimes it hurts when twisting. And finally, there are cases where pain occurs when standing up. Many elderly people only feel pain when standing up. There are quite a lot of people like that. So it's important to listen carefully to those keywords and make predictions. I think like this. For example, imagine a patient who complains of low back pain when sitting. In that case, the act of sitting causes the lumbar spine to make kyphosis, so the tissues related to the kyphosis are often painful. Another problem with the sitting posture is that abnormalities in the frontal plane are often observed. For example, when you're sitting and your left hip is raised, this is a problem in the frontal plane. There's also the issue of posture misalignment, so you need to evaluate that as well. And if you experience pain when standing, it means that your muscles are tense. For example, compared to other positions such as lying down or sitting, your muscles are more active when standing. So in this case, it may be myofascial low back pain. Also, what's the difference between standing and sitting? When standing, your lumbar spine makes lordosis, right? So you need to evaluate whether the pain is related to lordosis. And in the case of pain when walking, it's necessary to evaluate the movement characteristics of that walking. Its characteristics when walking. For example, pelvic elevation, shoulder depression, lateral movement, and so on. Observing the patient's movements while walking, you need to evaluate the mechanical stress of the movement and to visualize the tissues that are expected to be causing pain from the mechanical stress. If it hurts when bending forward or backward or when twisting, you can predict to some extent which tissue is the cause. For example, when it hurts when bending backward, it's predictable which tissues are stressed. The same can be said when it hurts when bending forward. It's very important to be able to immediately visualize in your mind the specific areas of the tissues that are likely to be stressed. And sometimes it hurts when standing up. I think this means two things. One is the characteristic of the movement when standing up. You need to assess how the patient stands up. Also, if you think about it, what kind of situation is it when standing up? If you think about it, it's when starting to move. As I'll explain later, there's a possibility that it hurts when standing up as the first movement. So it's not just about the movement of standing up. When starting to move from a still position, it's not just about the movement, but also about the possibility that it may hurt. And when it hurts is quite important. For example, when you ask patients when it hurts, some say it hurts in the morning, and some say it hurts when starting to move. For example, if you sit in a car for a long time, and then, when you first start to walk, it hurts for a while, but after walking a little, it gets better. There's a pattern like this. On the other hand, even if the same area hurts, there are other patterns where the pain gets worse in the evening, or the pain gets worse if you walk for a long time. Even if the pain is in the same place, these two are different. I think like this. There's no evidence for this, but if you feel pain in the morning or when you start moving, it's basically a gliding disorder between tissues. What I mean by that is this. Think of an old door. A rusty door squeaks when you open it. But if you open and close it over and over again, the sound will disappear. In other words, in the case of a gliding disorder, the initial period is painful as gliding is impeded. However, once you move a little, the pain goes away. This condition is exactly what a gliding disorder is. And if it hurts in the evening or when walking for a long time, it's due to a repetition of mechanical stress. For example, if the right pelvis is raised while walking, there's stress caused by that. Doing this repeatedly will cause pain. I think that's the pain based on this mechanical stress. And as shown here, age is also quite important. For example, if the patient is a teenager, you won't doubt spinal stenosis from the beginning, will you? In other words, diseases that are likely to occur are determined by age. Therefore, if a young patient has low back pain when bending backward, of course, you have to suspect lumbar spondylolysis. And in the case of middle-aged and elderly people, especially in the case of the elderly, when it comes to the intervertebral discs, you should expect very little fluid there. So, as shown in this figure, for example, herniated disc is quite common in young people. As you get older, it decreases like this. And what is on the rise is spinal stenosis. Spinal stenosis occurs because the spinal canal narrows as you age. And as you get older, compression fractures become more common. Compression fractures become more common as bones get fragile. These things can be predicted, and the location of the pain is important. You also need to evaluate whether the pain is localized, generalized, or segmental. It's because the location of the pain is determined to some extent by the disease. For example, in the case of intervertebral joint disorder, the pain is mostly localized. It's completely localized. Then you can point and say, it's here. The unique feature is that you can point at the location of pain with your finger. And the sacroiliac joint. In the case of sacroiliac joint pain, what's characteristic is that the pain is segmental. It's segmental. And disc disorder. The intervertebral disc is generally innervated from both sides. Therefore, disc disorders are characterized by the fact that they cause only low back pain and are bilateral. In that sense, if the patient strongly complains of low back pain on only one side, the pain derived from discs can be denied to some extent. Of course, it can't be completely denied, but you can evaluate it with the fact that there may be other causes in mind, right? That's what I want to say. And myofascial low back pain. This is characterized by a slightly wider range of pain. Based on these things, it's important to predict the cause to some extent depending on where it hurts. And the type of pain. There are various complaints from patients, right? For example, tingling pain, stabbing pain, shooting pain. There are expressions of pain like these. At such times, some predictions can be made based on the type of pain patients have. Of course, it's not entirely predictable. But as for throbbing pain, you can imagine that inflammation is the main cause. And, as for stabbing pain, it's clear that the pain isn't widespread, but localized. So it's highly likely that the cause of the pain is localized. Also, even though it's not that bad usually. There are cases where you feel a shooting pain sometimes. In such cases, there's some adhesion or gliding disorder between tissues, so I predict that if that part suddenly peels off, it'll hurt. And tingling pain and burning pain, there are cases like these. I think in these cases, the cause may be neurological to some extent. Don't you think this kind of interview is quite important? From these things, hypothesize the tissue that is causing pain. And after that, it's very important to evaluate in the order of high-frequency diseases. It means like this. It's very important. For example, as I said earlier about age, you won't suspect spinal stenosis in a young patient with low back pain from the start, will you? When a young patient has low back pain when bending backward, possible diseases are limited. In other words, for example, lumbar spondylolysis and intervertebral joint disorder, these are high-frequency diseases of them. In this way, you'll make an overall prediction during the interview, and you'll be able to find an order to evaluate. The order is based on the frequency of disease occurrence. Therefore, if you examine in that order, you can get to the cause quickly. This is important. Then, by evaluating them in that order right away, you can predict possible diseases. Then you can go into more detail and find out what's causing the pain, right? That's important. If you understand this, you can quickly find the exact cause. This is important. I want you to know that. There's a difference between skilled and unskilled medical professionals. In terms of evaluation and diagnosis in this regard, it's not just technical aspects. It's important that you're treating patients based on such imagination, not just technique. How was it? Did you understand the importance of interview? This time I focused on the overview of interview about low back pain. I'll cover the importance of interview for each disease. The important thing during an interview is to listen carefully to what the patient has to say and appropriately extract keywords from it. I think you have now understood the true meaning of interview. Well then, I'll see you again in the next lecture.